Welcome, and thank you for your interest in the Registered Wonders and Worries Provider Program. I'm Melissa Hicks, and with Meredith Cooper, co-founded Wonders and Worries in 2001. Since we founded Wonders and Worries, we have grown exponentially. We have supported thousands of children and parents, developed a clinical expertise related to the impact of an adult's illness on children and youth, have qualitatively reported the positive impacts of the program, and now have had the positive impact of our 6-session illness education curriculum quantitatively validated through a randomized clinical trial. What a journey it has been, and I am so proud of all Wonders and Worries has accomplished over the years. We are so committed to this population that since its inception, Meredith and I have always had the goal for families outside of Central Texas to have access to the type of support offered by Wonders and Worries within their own communities, across the states, across the world. I am thrilled that through this training and support program, that goal is starting to be realized. So thank you for your interest in taking the time to listen as I walk you through some of the specifics related to the Registered Wonders and Worries Provider Program. While I know each setting will use the program in a way that best meets the needs of their community, I thought it'd be helpful to just share some fundamental information about Wonders and Worries in Austin in Central Texas and how we deliver service. From the beginning, these 3 goals have remained consistent and drive the work we do both individually and in group settings. So our 3 things that we have always worked on and have always focused on are providing age-appropriate understanding of illness, treatment, and side effects, facilitating communication of feelings related to changes in the family, facilitating with the child with their child life specialist or their mental health professional who's working with them, but also family communication between each other, because that is paramount as families walk through the challenges of illness. So we want to make sure that we are promoting that intra-family communication. And then identifying individual coping skills and helping to ease the stress, sadness, anger, fear, and the myriad of feelings that come when an adult in a child's life is diagnosed with a chronic or life-limiting illness. For more specific information about Wonders and Worries as an organization, I'd encourage you to watch our Wonder Chat on program development. It highlights our values as an organization and how our program offerings and delivery aligns with those values. Let's dive into some of the specifics about the Registered Wonders and Worries Provider Program. Let's start with who. Who may be interested in this training and support curriculum? One of these areas may speak specifically to you and your goals for professional or programmatic growth. So it could be child life specialists and mental health professionals who want to enhance their clinical skills working with children and youth, ages 2 to 18, whose parent or primary caregiver has a serious or life-threatening illness. It could be clinicians who want to use an intervention proven to be clinically effective. We all know how helpful that is as we're talking to leadership and supporting services and service delivery if it has clinical validation. Clinicians who are consulted to services in adult areas at their healthcare institution. I remember being a child life specialist based in a hospital in oncology and pediatric oncology, and being consulted often to the adult service lines to help children of adult patients understand their parents' illness. And then it could be organizations who are interested in offering a comprehensive support program for children and teens impacted by an adult's illness. So why Wonders and Worries? Why partner with us? Why become a registered provider of our curriculum? Well, because there's data-driven validation of its effectiveness. You know, it is the only formal curriculum-based intervention that has been validated by a randomized clinical trial. We all know that that speaks volumes. Its curriculum has been subjected to a formal evaluative process as well, and we've done that since the beginning, evaluated our services, had outside evaluators come, and that is published as well. That research can be found on our website. As a registered provider, you have access to our current leading edge curriculum and materials, and also access to our support team. So instead of us just training you in our 6-session curriculum, we really want to support you. We want to kind of bolster you up and help you as you develop your services in your community. So we have our curriculum, our illness education curriculum, but as we develop new curriculums and validate new curriculums, those will be available to our registered providers as well. Organizations will benefit from our ongoing significant investments in curriculum development, clinical research, product development, and branding. And then sometimes working in roles outside of the hospital or in a different service line can sometimes feel professionally isolating. So interaction with a network of professionals working in similar roles may help decrease that sense of professional isolation. We really want our registered providers to support and network with each other as they deliver these services. So let's talk about where this program and curriculum can be implemented. It can be part of a toolkit really in any setting supporting children of adult patients. You might even pull those tools out sometimes when you have a family member or a friend who has a child coping with an adult's illness and they ask your advice. It could be adult hospitals and those consulting to adult service lines or units. It can be palliative care, hospice programs, private practices, community support organizations like maybe the MS Society or the American Cancer Society, and potentially schools. So there are many benefits to becoming a registered Wonders and Worries provider. So I'd like to share those with you now. As part of your initial registration, which lasts for 3 years, you'll receive 20 hours of training, which is PDU for Child Life Specialists and CEU approved currently by the Texas Board of Social Work. And at that training, it's dynamic. We're providing content information. We're training you about our sessions. We're role modeling. We're practicing. It's a very interactive type of training. In addition to our in-person training, we have our virtual training that will be offered in the fall of 2020. And we are building those pieces into that as well. So there'll be the didactic training, but in addition, there'll be opportunities for live sessions, synchronous sessions via the computer to be able to talk to the clinicians from Wonders and Worries, to talk with other registered providers walking through the program to provide that dynamic interaction as well. Registered providers in those first 3 years receive 8 hours of individual consultation. Our clinical supervisors can offer consultation related to clinical cases or programmatic development or program offerings. And then in addition, we do have some access to resources that may be able to provide some consultation around some other areas such as business practices. Additionally, 8 hours of group consultation is available. Those are scheduled quarterly. They will be online, phone calls, Zoom calls, that will allow registered providers to come on and connect with each other. And those will be offered, like I said, quarterly, and 8 of those are available to use in those first 3 years. So additional benefits are exclusive access to our illness education 6-session curriculum, which is the one that was validated by the randomized clinical trial. We have a teen curriculum that is getting ready to roll out to our clinicians at our Wonders and Worries organization right now. That will be available. We have an advanced cancer curriculum, which is currently being researched, that we're using that right now for a study. So that is available to our registered providers. And then access to a Wonder VR, which are virtual reality-based applications. Our first one is a virtual treatment center tour so that children can walk through and experience some of the things that their parents may be experiencing when they are going for cancer treatment. Our registered providers will have access to a dedicated portal with content designed to help build clinical skills and programs and services. So it's a sign-in, password-protected site where our providers will have access to activities and forms and business practice ideas and things like that to support them as they move forward providing Wonders and Worries type services to families within their communities or institutions. Our providers will have access to mobile applications that we have in development. Currently, our teen app is completed, and then we have a caregiver and professional app that are on the horizon. So additional benefits would be listing on our website as a registered Wonders and Worries provider. You're listed under partners so that if people in different areas are looking for someone to deliver this type of curriculum, they can check their state and see if there's a registered provider in their area. There is a logo specifically designed for use by our registered providers. You can use that on your flyers. You can use it under your signature, just a way to indicate to people that you have been trained and approved to use the curriculum. We offer a helpline at Wonders and Worries where we get calls from families or parents from all over asking for support, and they might have a question that needs answering right in that moment. And so we certainly do that, provide that support and triage that, but then look for an opportunity to connect them with someone in their local community who may be able to provide them ongoing support. So we would look first to our registered providers in an area to make that referral. And an invitation to attend an annual networking conference. We really think that there's value in bringing people together, and that synergy and the networking and the sharing of ideas and practices is so beneficial. So we are committed to offering that to our registered providers annually to attend so that they connect with other people who are providing these services as well. So let's talk about some more benefits. You can use the name Wonders and Worries when listing program offerings. The distinction needs to be made that our providers are not employees of the Wonders and Worries organization, but instead a clinician who's been trained and approved to deliver our curriculum or content of that Wonders and Worries program. So registered providers are permitted to run their business in whatever way they see fit. For example, a clinician in private practice may charge clients as they deliver the content of the curriculum, whereas we at Wonders and Worries as an organization do not charge families for service. Along the same line, registered providers are not permitted to use the Wonders and Worries 501c3 in their fundraising efforts. And I'm happy to speak to individuals about this distinction if there's questions as we move through. Additionally, provide access to the PDU CEUs associated with our Wonder Chat webinars. You may be aware we started offering these. They're running monthly. It's exciting to be able to offer clinical content relevant to our professional peers. And so I hope that you'll participate in those. But again, our registered providers do get those CEUs or PDUs at no cost. And then we developed some programming related and mission related materials that will be available for sale to the public or other professionals, and our providers will receive discounts on those. So one of those is an activity book with therapeutic activities that we're publishing. We have a book series that we're working on called I Wonder. So when those kind of offerings come out, our registered providers will be able to receive those at a discounted rate. So in addition to the benefits that I discussed for the individual registered provider, I'd like to elaborate a little bit on the institutional additional benefits. So for every registered provider that the institution has, that individual will receive all the things I've already discussed: the 20 hours of training, the 8 hours of individual consultation, the 8 hours of group consultation. And then in addition, the institution will receive 4 additional program consultation hours per year, a 2-day site visit and consultation, engagement, collaborate, and participation in research. We are encouraging that. We really want to engage with other institutions to be able to provide opportunities for multi-site research opportunities. The ability to use the name of the program for co-branding. Hospitals ask about that a lot. So yes, they are permitted to use the Wonders and Worries registered provider logo, name in their branding. And then if there are 3 or more registered clinicians at a site, we can talk about, and we would certainly consider providing training at that site that may help with the costs for institutions. The institution would cover the travel expenses for 2 Wonders and Worries staff to come to their setting. So let's talk a little bit about the fee structure. Individual pricing for the initial 3 years is $1,200 for a registered clinician, and that provides all the benefits that we've already discussed. Financing is available for that, so that would be the individual pricing. Institution pricing is a little bit different because it's based on the number of clinicians at your site. Obviously, if there's 1 clinician versus 4 clinicians, the site cost is going to be different. So we quote those prices out for institutions on a case-by-case basis. Institutions can also apply for financing as well. And then after the initial hours of consultation are completed, we do have an option for the purchase of additional consultation hours as programs develop and grow and move through their service delivery. So after the first initial 3 years, what happens next, right? So you need to renew every 3 years, and that renewal includes continued access to the curriculum or any curriculums we've developed and the resource portal. So as that's growing and things are being added to it, additions are being made, our registered providers who have renewed will have access to that continually. You have use of the logo and status listing on the website. In your renewal 3 years, you get 8 additional group consultation hours to use in that 3-year period. Invitation to the networking conference, the access to the PDUs for the Wonder Chats, the discounts on products like we talked about for the mission-related products that we will sell. And then institutions will continue to have those research opportunities and the co-branding permission. So count me in, right? So what's next? If you're feeling like this sounds like the perfect opportunity to be able to have a validated curriculum, to be able to deliver these to families in your institution or your community, have the support of an organization who's been around for a long time. We have a lot of experience and a lot of expertise in this arena that we can help you and support you with. So the next steps would be to submit the application that is available on this website. I will then call you to discuss the application, your experience, your goals, where you're hoping to go with this. And then we would move forward. We'd have some contract signed, fees paid, and then you would attend your training. We offer the live training in person in Austin, and then we also will have the training available virtually in the fall of 2020. So what to expect after training? Well, you'll receive the schedule of group consultation times and topics that you can put those on your calendar so that you can join and engage with us in the group setting. Access will be granted to the Registered Wonders and Worries provider portal that has all those resources and forms and information that I discussed. There's a private email group that you'll be added to for Registered Wonders and Worries providers so that you can connect and network with each other and with us on staff directly. And then you'll schedule your times for your individual consultation with your individual consultant. So the Registered Wonders and Worries providers are part of our Wonders and Worries family. We want to support your success. Like I mentioned earlier, we don't want to train you and just hope that for the best, that it all works out well. We really want to train you, support you, stay connected, stay engaged, learn from each other throughout the years. So we hope you'll join us. Please let me know if there's anything I can do to be helpful to you. My contact information is here. I am the director of the program. I am the person who will connect with you throughout the whole process from the beginning, answer questions, get you into the fold through the training, and then the person who will support you and connect you with the appropriate people and resources as you roll out your offerings. Thanks again for your time today. I appreciate it, and please reach out if there's any questions at all.